Methotrexate, also known as amitriptyline, widely used for treatment of cancer, originally synthesized by La Brigada and clinically developed by Signiferer.
Methotrexate inhibits DHFR, which involved in the conversion of dihydrofolate into tetrahydrofolate. Without tetrahydrofolate, DNA synthesis cannot proceed, thus cell division cannot occur. Prolonged use can cause hepatotoxicity, fibrosis, and cirrhosis. Most common adverse effects are ulcerative stomatitis, nausea, abdominal pain, fatigue, and others.
Hello, my name is Rosiliana binti Harun. I'm going to present about ATC code for methotrexate and label chemical structure and chemical name. Firstly, drugs are classified according to ATC classification system and it's controlled by WHOCC. In this system, the active substances are divided into different groups according to the organ or system on which they act and their therapeutic, pharmacological, and chemical properties. The group of drugs are classified at 5 different levels, and this is ATC code L01BA01. Methotrexate also has an ATC code known as L04AX03, which used in immunosuppressive therapy to treat autoimmune disease or diseases that are most likely of autoimmune origin. Next, this is labeled chemical structure and chemical name for methotrexate.
Annotation of aromatic ring or heterocycle and key functional group. This is methotrexate structure. The first one is diaminoteridine ring, amine, benzene, amine, and carboxylate group. Chemical reaction that lead to chemical decomposition or metabolic degradation. Polyglutamylation is a process adding glutamate radicals after the already existing glutamate, which increase the molecule's negative charge, thus enhance its intracellular concentration by inhibiting the efflux out of the cell.
Now, let us see the structure of methotrexate in more interesting way, the 3D structure view. This is the crystal structure of dihydrofolate reductase enzyme and binding of methotrexate in different type of 3D structure view, which are backbone, space fill, ball and stick, ligands, which is methotrexate, ligands and pocket, trace and ribbon 3D structure view. Next, this is a map of ligand-protein interaction which show the active site of enzyme dihydrofolate reductase in complex with the inhibitor methotrexate. In more detailed structure, the ligand binds to the active site of protein pocket mainly by hydrogen bond, which presented by black dash line.
Hi everyone, I am Ali and I am going to tell you about CADD, computer-aided drug design on methotrexate. Using ChemSketch software, methotrexate structure is drawn in 2D and 3D forms. First, this is methotrexate in 2D structure. Next, these are 3D structures, ball and stick form on the left, stick form on your right, and this is space volume form. The last one is in certificate 3D structure. In this form, the atoms of different chemical elements are distinguished by popular color convention. Minimization energy of methotrexate is determined using HyperChem software.
Hi, I'm Biling. Now I'm gonna present the physical-chemical properties of methotrexate. The molecular formula is C20H22N8O5. Moving on, MTX has 5 hydrogen bond acceptors and 7 hydrogen bond donors. MTX's log P is 0.05. Since it's less than 0.5, it is a hydrophilic drug which is water soluble. pKa and percentage of ionization. In stomach and jejunum, MTX is greatly absorbed since they have low percentage of ionization. We can also predict the solubility by Lemke's formula too. This method shows that methotrexate is water-soluble, but in reality it is almost insoluble in water. Lipinski's rule of 5. Poor absorption occurs when the drug has molecular weight more than 500 Dalton, more than 5 HBDs, more than 10 HBAs, and log P value more than 5. Since our drug obeys 3 of the Lipinski's rule, therefore it is an orally active drug. That's all from
Hello,
me.
I am Sujan, and I'm here to talk about lead optimization of methotrexate based on lipophilicity and steric effect. First drug is on lipophilicity. First of all, here's something you should know. So, gamma carboxylic group of methotrexate is substituted with hydrophobic ester group. Due to that, drug becomes more lipophilic, improved uptake of drug into cell, and Lipinski rule of 5 is obeyed. Second drug is on steric effect. Alright, methyl group is replaced with hydrophobic bulky structure to increase interaction in binding pockets. Added groups are not too bulky to prevent steric hindrance that will affect potency. As a result, Lipinski's rule of 5 is obeyed and this drug is considered orally active.
Third, new drugs. Bioaccessory replacement of carboxyl group by tetrazole group result in enhanced potency due to reduced hydrophilicity. Increased potency of this drug includes higher inhibition of DHFR, higher ability to form polyglutaminate, inhibition of target other than DHFR, and accumulation in cell to higher level. Methotrexate catalyzed by enzyme more easily, metabolized faster, and excreted out with shortest duration. This toxicity reduced leading to fewer side effects, so Lipinski's rule of 5 is fulfilled. Conclusion: has some adverse effect and toxicity which delayed drug clearance will lead to kidney failure. With optimization, increased drug lipophilicity, variation of substituent with steric effect, and bioisosterism which lower its adverse effect.
Created using Powtoon.